Welcome to the 360 Degrees SCD Hub live broadcast show and interactive community chat. This show is designed to do three things. 1. Empower those living with sickle cell disease. 2. Educate the medical community to improve overall care. And 3. Encourage the general public to learn more and how to support this community affected by this disease by downloading our app and joining our community platforms. Whether you are living with sickle cell disease, part of the medical community, or the general public, our goal is to connect and unify everybody to improve care for all. This show is co-hosted by the Sickle Cell Foundation of Arizona and the Force for Health Network. Each month will feature special guests from our partner organizations and will include an interactive way for participants and viewers to interact with us. We encourage you lend your comments on our live streams and to download our free 360-degree SCD Hub app through the QR links below or by visiting our website at 360scdhub.org and join today. Together, we can make a difference for the entire SCD community. Now, let meet today's co-hosts from the Sickle Cell Foundation and the Force for Health Network.
Hello, everybody. Welcome to our second monthly broadcast called Monthly Insights with the 360 SCD Hub. I am your co-host, Lucy Howell, out of Tucson, Arizona, and this is my partner, Dr. Robert Gillio, out of Pennsylvania. And as soon as I get a notification from our co-hosting partner with the Sickle Cell Foundation of Arizona, I will bring him up onto the stage as well. And in fact, I'll just go ahead and do a little Moses. If you go like this and just want to come on in as is, because we're not going to do a background, give me a thumbs up. Okay, we're just going to go ahead and bring him onto the stage, and let's go ahead and really also take back this. It's a little busy. Moses, how are you?
I am well. Thank you for asking.
Very, very good. So as this is a new brand and this is a new project, so to speak, for the Sickle Cell Foundation of Arizona, I still think it begs this overall welcoming overview and activation message from you, our trusted leader in this, as to what it is that we're trying to do. So this is a regular broadcast. You may be joining us live from Facebook or YouTube or LinkedIn. Like the intro said, it really is designed to connect and unify and empower the entire ecosystem for the Sickle Cell Foundation. So we're very excited to be working with the host. Really, we are your co-host partners on this initiative called the 360 SCD Hub. So Moses, please welcome our audience. Please remind them what we're trying to do here together with this platform. And I'm happy to bring up some graphics. Basically, also, the show will always address our three main audiences. If you're living with sickle cell, we'll have some tips for you and some resources. If you are from the medical community, that's school nurses, that's community health workers, and of course, physicians of all kinds, either experts or wanting to learn more about improving quality of care. And then the general community. It's very important for us to all be more empathetic and aware of some of the pain issues that are more relevant and persistent in sickle cell patients than not. So with that being said, we will be inviting a special guest later on in the show in about 15 minutes. Casey, who will be serving as our community liaison. And then Rob's going to take us on a 360 Human Explorer tour on the system to learn a little bit more about the disease. Just wanted to lay that out there as the agenda. And so Moses, founder, executive, director, and owner of this project, 360 SCD Hub and the Sickle Cell Foundation of Arizona. Welcome.
Hello, everyone. Thank you for this platform. Thank you for the opportunity to bring everyone together through this medium. It is humbling when we think about where we started from and where we are now. I'm so excited for the partnership that we have with Force for Health. Dr. Gilio, that's just not a name. They're actually individual people you can see right now. Lucy and Dr. Gilio, and of course, Casey. So it's exciting. Sickle cell disease is the most common genetic disorder identified among African Americans. It's also actually found from South and Central America and the Mediterranean and Middle East countries. So, but for a long time, it's kind of like sitting in the background, like in the closet. And because of the stigma, the social determinants of health, all the impacts, didn't gain the visibility that it does have today. And we're excited about this platform because it gives us an incredible opportunity for you, whether you are in the medical community, for you, the individual who may be afflicted with this disease, it's a terrible disease, and for the families, and of course the public, to get to know one-on-one in the privacy of your own home, at your own time, in your own space, to know about this ailment. So you don't think that it's leprosy, or if you shake hands with somebody who has sickle cell, boom, you guys sickle cell. Sickle cell is a genetic disease that is transferred from parents to the offspring. So it is exciting that we have this platform to share, to connect, to intermingle, to learn, to understand, and to motivate, to encourage, to support, and to learn. So I'm excited. I am humbled.
Well, I'm humbled also, but I'm also motivated by what you just said to ask you a question, if you don't mind. As I'm a medical director on this project, and I listen very carefully for precise things people say. And you said that it's not something you get from germs like leprosy, from handshakes, but you get it from your parents. Please clarify. Let me ask you this question, sir. If your parents if your parents have the disease, will you get the disease? Do both parents need to have the disease? Do you get screened for the disease? I say that because in your app that you've built, you have a great course about the genetics and about some of those issues for parents. But a common misconception is, if I'm a sickle cell trait, will my kids have the disease?
Thank you for asking that question because it's very confusing. And most people don't pay attention to it. They may actually carry sickle cell trait and don't even know it. Mm-hmm. So first of all, I'm not a doctor. I'm not a medical profession. You are. But the information is there. You don't have to be in the medical school or anything like that. It's transferred from parents. The disease has 25% chance that if your mom and your dad carry the sickle cell trait, you have 25% opportunity of having the disease. You may carry the trait, or you may not have anything. You may be fine, just like any other person. So that's one aspect of it. So it's imperative that every individual, especially of African descent, be tested. Fortunately, in the United States right now, and in Arizona in particular, there is what is called newborn screening. When a child is born, a blood clot sample is sent to Arizona Department of Health. And they diagnose not just sickle cell, any genetic disease. So they can find whether that child has sickle cell or not have sickle cell, or is a sickle cell trait. And if you don't know, please go to your doctor. Very simple to find out.
Yeah. If in doubt, get screened is the thing. I'm thinking, again, to stress what Lucy said or what was said at the beginning, this app is for the patient and their families. It's for their caregivers. It's for the general community. And so if you're an adult and you don't know if you've ever been screened, ask your doctor. Get screened. It'll help with the planning of your own health, certain issues, if you carry the trait or not. You still have some risks, for sickling and some other such things. But for reproductive purposes, if you're thinking of having a family, it sure makes a lot of sense to get the sickle cell to know your status if you are a carrier or if you are not. If your spouse is not a carrier and you are, there's no way your baby's going to have sickle cell disease, but they might have trait. One gene from the father, one from the mother, both have to come together. But what's nice is in the app, there's, as Lucy's showing on the screen, there's courses, and then there's that you can earn when you look at the app on your handheld device, or as you're viewing it right now, right there on the computer screen as well. What's neat is it takes you a little deeper. And this is the point I'm trying to make as a medical director and as Moses as president of the Sickle Cell Foundation of Arizona. No one knows everything, but the Centers for Disease Control has done a great deal of work pulling together research from literally thousands of researchers, hundreds of thousands or millions of patients and therapies and instances of sickle cell disease. So if what you'll find when you're using our app is we'll dig deeper and oftentimes might take you to a CDC resource. Something that's nice about the app is the CDC has so much that what we've tried to do is distill it down to where in a couple hours over time, you can get really good at it without going through a million documents. Lucy? Lucy, you're on mute.
My bad. Sorry about that. I had a barking dog there. My thing is that when I go like this, every time somebody says the 360 Hub app, I just feel like we're selling it a little bit short, because everything that you've built, Moses, that we've helped, developed upon your lead is available in large screen computer, right? Tablet, and in an easy to use app. You can see right now that the 360 Hub, SCD Hub, is really a brand, because even with this broadcast right now serving the community of which you are targeting, those living with sickle cell medical and general community, it is really a brand. So an app is one of the tools, right, that we co-developed alongside the Sickle Cell Foundation under your direction. It was the app itself was funded by HRSA off of a grant, right? But the other things that you might see coming to fruition, perhaps 360 SCD challenges, or this 360 SCD community health worker app development training. Those are, services and things that complement what we're trying to do. The app is the mechanism. That's the baby that has, the tools in it that you can, that's my wrong one that I didn't want to show yet. This one, this app, this platform, this community has buy-in from your ecosystem starting right here in Arizona, right, Moses?
Yes, indeed.
We took it through a intensive review process with doctors and health tech and residents. And so it's just more than an app. That's all I'm saying. It is really a platform, and it's a community with tools that then can be used. And what's fun about the tools is that if you are logged in, it's nothing to join. If you are logged in, anything that you do on the app will earn points for you. And it's just a fun way to we can track some engagement and give some prizes away, right? With some nice announcements coming up for June that we'll talk about shortly.
Well, if someone's looking at this right now, go back one screen, please. Right this screen, stay right here.
Sure.
Is the little checkerboard squares, what are called QR codes. That's the easiest way right now. If you're just watching this on a big screen or on someone else's phone, you just look at that with your camera, activate the QR code, a little yellow bar come up, touch on it, and it'll take you right to the web store. Or you can go there on your own with the Google Play or App Store. That's an easy way to get the app and join. And I noticed in the big middle red banner, it's very important to everyone on this team. This is free. The disease doesn't care how rich or poor you are, neither do we. We need to have knowledge is power, and we're here to share that knowledge the best we can with you all.
And additionally, we want to remove the mystery of the disease. Again, Dr. Gilio, knowledge is power. We are intentional. This is a mission. This is not just something that happens accidentally. This is a mission to remove the mystery from the disease. I tell people, you got to love the disease. They say, why do you say that? I say, because you have to love yourself.
Yeah. I think from a doctor standpoint, there's a real mystery. I'm up here in rural central Pennsylvania, where I think I'd have to work hard to find a patient with sickle cell disease within 50 miles of me. I'm being very serious. But yet, when I see someone, I have to know about the disease and not have any mysteries about thinking about, could this patient have sickle cell and how would I treat them? So it's important for physicians like me in an area that has very little sickle cell patients, because with the college, with the sports events, with the concerts, when people come to our town, they bring with them their health issues, their genetics, and everything else. So it's important for the doctors to also have pride in overcoming that mystery and being earning their sickle sense is what we call our rewards. Kind of the common sense of how to treat the disease, but the sickle sense is what you earn when the doctor takes their little courses as well. One of the things that I challenge any doctors that may be watching this is the whole thing of transition of care. This used to be a pediatric disease because they all died. They never made it. It was horrible. Wasn't understood. And eventually kids were having a heart attack or stroke, something awful in their teens. It can happen. And very few made it to adult medicine, adult internal medicine, adult hematology. It wasn't diagnosed until end stage oftentimes. So transition of care from pediatric to adult practice is one of the tools we put in there for the doctors. If they're thinking, what else am I going to learn? Well, there's a nice little toolkit there with all the forms for your practice to be a little more efficient about it. As you log in and you're in as a physician in your group where the physicians' courses are housed.
Yes, Dr. Gilio, transition is imperative. It removes the blind spots. Of course, they transition from different ages, but from young adult to adolescent to adulthood, it's imperative for the person to understand, to know how to take care of themselves, because you got to leave home, you got to get a job. Doesn't mean that because you have sickle cell disease, you don't have a life. Our mission is to show that, yes, you can live productive, supporting, encouraging, motivating, joyful life in spite of the disease.
I agree. I think the joy is a big part of it. And I think empowerment also. Do you realize what we're trying to do is, if you notice when Lucy was just clicking through those screens, there was a transition of care course for everybody in the app, even the patient or the office manager in the practice. There's material for them. And so the point is, you have, look at the offerings here. It's a coordinated team is what we're trying to build here. We're building a community, a hub of people looking in from all ways, 360 hub. And so everyone has a role to play, especially the patients and the families. They have their HIPAA rights, have them demanding information be shared in a timely fashion, appropriate referrals, et cetera, getting their care paid for. So an empowered patient goes a long way towards reducing morbidity and mortality.
So I am going to take that short break here and maybe try and use this towards transition. I love that you emphasize that, Rob, because again, I'm going to emphasize this throughout all that we do, because the ecosystem has those three parts: living with sickle cell. And when I say living with sickle cell, I mean you're a parent, you're a caregiver, obviously if you're living with sickle cell, right? But we're talking about the families. Yeah. And the extended families. So that's the category of, when I say living with sickle cell, right? The second one is the medical community. So if you are an expert, we would love your, eyeballs, your contributions, blog posts, and interview subjects. Please join us. And then the third would be the general public. And we're going to talk about that a little bit more, but let's use this time to transition into, it takes a village to do this. And one of our partners in here, as we were going and talking to all the partners and really aggregating everybody, it became very evident that it would be nice to have a train-the-trainer type of liaison, somebody that knows us very well, Force for Health, and somebody that can obviously represent Sickle Cell Foundation in the community so that we could hyper-train and get some folks coming on board here. So our next guest is just that person. And so I'd like to go ahead and introduce Casey Nyquist to the conversation. Casey is based up in Phoenix. Rob and I had a fabulous time working with her as a senior NAU intern for us one semester. And I just wish that all interns were like Casey: proactive, organized, cheerful, accountable, thoughtful, empathetic, just all of the boxes. So very excited that when that internship ended, we were able to actually hire her, because that's when we were hired by you guys, right, to help co-develop this app. And we had just taught her how to do all of this stuff for another grant that was a CDC kind of backed information in maternal health and infant mortality stuff. And so it was perfect. So now we get to share Casey. She is both, still with the Force for Health, but she acts as a Sickle Cell Foundation liaison and coach and train the trainer. So Casey, welcome to the conversation, and share with us basically what your role is over the next few weeks. And we know we've got some nursing school stuff coming up, but share with us your role and your thoughts on the subject so far.
Yeah, so I think my main role is just to make sure that everyone knows how to use the app most effectively, whether it's someone in the medical field, someone who just has a family member who's experiencing it, or someone who just wants to learn more about how to better their life with sickle cell, or just with someone they care about. I think we all live super busy lives, so having someone there to kind of show you the ropes, show you how to manage all these new technologies that are going out, and finding the best resource for you is super important. And then also just being able to connect with someone and be like, okay, we have this amazing resource, but it still needs a little bit of tinkering. What do you need? How can we help you in continuing to improve what we've already put out there for something that doesn't have a lot of information for a lot of different things? I know Dr. Rob was talking about how he lives in an area where you don't really see a lot of people with sickle cell disease. And I know I've been blessed. I work at a county hospital here in Phoenix, and I've seen a couple of patients with it. And it's also a teaching hospital. So I've seen how a lot of the residents still don't know a lot about it themselves. And so I think it's extremely interesting to see the different dynamics, and have seen this app go from nothing to something so quickly, and see how there's still so much potential for everyone using it.
And that's great feedback. I pass the baton to you, Moses, to go ahead and make your additional announcements about, because I know you're excited to have someone like Casey in this role. So what are you thinking about that official role of coach and liaison for the Sickle Cell Foundation of Arizona?
Well, I'm very, very excited about Casey, and I thought it was a great decision to bring her on board with us for the duration that she has available. We all know that the highway of .coms are littered with a lot of failed initiatives. And so when you launch a mission as ambitious as this, you don't have room for failure or disappointment. You want to go full thrust. And so it's exciting to have her. In fact, today we had our training with our community health workers and other members of our organization to do. We always talk about this. You know, when you talk the talk, you got to walk the walk. It's about training the trainers. Charity begins at home. It might as well begin with us. That she comes and train us, member of our organization, so that when she leaves, we can't clone her. Wish we could. So we can, our community health workers and other staff can also replicate what she's been doing, and we can in turn train other people, because the app is of no use, or the platform is no use if nobody uses it. Doctor prescribe a medicine for medication, you don't take it, doesn't matter how many times you pile it up. So we really want to use, and we really want the app to be impactful, to be a positive instrument in the lives of the family. The family member, even though they may not have sickle cell disease, they suffer just as much as the individual who has the sickle cell in that family. So we really, I don't know about it, but we really want to encourage the family members to participate, to be informed, to know more, so they can take care of their loved ones. So Lucy plays a major, yes, Casey plays a major role in transferring the knowledge that she has. We vacuum her brain. Really, and so we're excited about the role she's playing. Thank you.
You know, with Casey, really, one task is to get the internal Sickle Cell Foundation of Arizona board, healthcare, the community health workers all up and trained. That's one of the tasks. But the other one is really then to also help co-host and lead our monthly webinar and live office hours. So for the, the rest of the public, if you are, again, a school nurse, a community health leader, maybe you're even a parent that has to lead a group, right? If you want to learn how to use this for the people that you are in charge of, we offer this free webinar on the third Tuesdays of the month, and that kicks off this month. So just wanted to kind of bring that up. There are really pieces of the app. If you're living with sickle cell, this tracker piece right here, this component, heat or weather and pain and hydration, all of these things are super important, but sometimes it's just nice to have somebody handhold you and go through. Now, every single feature in the app has a little tutorial, so you can go ahead and just watch a video. But the app training is only half of what you're doing. The other half is really outreach, and we emphasize newborn families and the fact that Arizona screens. I mean, all states, as of what date? I don't know, the last 10 years or 12 years, do newborn screening for sickle cell.
Yes.
All 50 states, but
mostly,
right?
I think so.
Right.
Yes.
So then we can extrapolate that, if you're 10 to 15 years old, I don't remember the exact cutoff date, then you probably were screened at. But if you're older than that, then perhaps that's where those comments were coming in earlier, Rob, in terms of like, if you don't know, go get screened, right? But you have been like literally calling people, right? Because that's the outreach effort that we're really taking all the way around to make sure that people are outreached to. So both group leaders and then the families. Any kind of like general comments about, folks that you've reached out to or anything you want to share with us?
Well, I know through reaching out to a lot of the families, I think a lot of them didn't realize how many resources there are out there. So whether it's things that I don't have a lot of knowledge on, there's always someone I can get them in contact with who's willing to help them. And I think it's important to realize that this isn't a disease where you're going to be alone. It's not a one in a million type thing. There are so many people who want to help you get better, feel better, and there's so many people who just want to help you in general. So if you put yourself out there, if you let us help you, we're willing to.
I love that answer. You're absolutely right. And really, sometimes it's just that one person and single contact that can be this plethora of, resources come flushing through. And you're the perfect person to take that lead. So I really appreciate it. Rob and Moses, final thoughts for Casey here as we close up this segment, and then we get to talk about what's on the horizon, which is exciting.
Well, you are reaching out to leaders as such, but I think people watching this, they don't need to necessarily be you. They could mentor that one person, their best friend, their child, their neighbor, their employee, that school nurse for the child, whatever. And that one person can make the world, give that person the sense of joy and opportunity that they can have a good life with sickle cell. That's what I like about this whole thing. Thank you for what you're doing, Casey.
Thank you, Casey. Part of this effort is nobody should feel isolated.
Yeah, good.
Wherever you are, even if you are the only person in that community who have sickle cell, the only family in that community, you should not be alone.
Yeah, and
this to give you the platform.
We have the social tools and the platform to help bring together those communities and those groups. Very good point.
Yeah, and in fact, it reminds me of our barrier to care tracker embedded in the app. So if you feel like you need care in one way, shape, or form, and you can't get it, there is a mechanism for you to just kind of record that feeling right there. And the more you invest in recording your feelings, your pain, your responses, your treatments, then the more you're just investing in the information you can share with others that then will be able to help you. That's really what it's all about. I know we're running over time and we've got 2 segments left, not 1 segment left. So Casey, thank you for joining us. We're looking forward to seeing you more in a driver position with some trainings coming up, and good luck on your upcoming nursing school challenge. Okay, so we'll talk to you later. Thanks for joining us.
Bye.
Bye.
All righty. So Dr. Rob, we've got about 20 minutes and I need about the last 10 to talk about what's coming up on the horizon. So let's do a 360 sickle cell human explorer tour so that we can understand a little bit more to cellular and granular level using some of the tools from the platform.
Well, let's try this. Just verify that what you're seeing here. We're on the 360 Sickle Cell Hub web page. Okay. And on that web page, I have a series of things on this left side, and one of them is called My Courses. And I clicked on My Courses, and I picked the 360 Human Explorer Challenge. And there's a variety of things here. I wanted to focus on some basic concepts right now. You can see that this one I already took, pulmonary hypertension. It's crossed out. But I was playing around today with a couple of concepts, and one
probably
of
on page 2 if you're not seeing it.
Yeah, that's entirely what I'm thinking. Let me just go to page 2, and sure enough, there's the one I added today. But before I go there, I want to go to this one. I'm clicking on a blood vessel. Notice when I click on it, I have a series of tools here, and I have a quiz I can take, but I won't take that right now. I can go to something called full screen, which I like to do. And that shows text on the left side here that describes, in my words or in the words of other experts, things where what happens, how can this patient end up, let's say, with this horrible situation with their finger where this area isn't getting much blood. And so this model, I can rotate and look at, but I want to illustrate the concept of a blood vessel has a series of different membranes and parts to it. And one of the things that happens is that it can constrict or it can dilate. When it dilates, the hole in the middle is bigger and so much more blood can flow through the pipe. One of the things that causes obstruction is when a blood vessel is narrowed. It's called vasoconstriction. And when that happens, it's more likely that the blood will potentially block that vessel. So let's go back to that previous concept. And one of the things that can make that blood vessel dilate or constrict is temperature. And so one of the things we talk about is when it's really cold, your body near the outside wants that blood vessel to squeeze down. When that blood vessel squeezes down, less blood flows through. One of the things that you may notice here when you're looking at things is that blood flows in what's called laminar flow. Look how beautiful that is. It's just coming right at you, and I just love this view. It's just a kick. I just get immersed in it like a video game. But here's one of the things that scares me. When these blood cells sickle, when they have lower levels of oxygen, the hemoglobin in the cell causes the cell to change shape and looks kind of like an old sickle that you cut wheat with, a sickle shape. And when that happens, those things can get next to each other and eventually thrombus. They get stuck with each other. And when you're looking at the flow that's coming at you now, there's a lot less blood flow going down to that finger, let's say, because this is a crisis that has happened, a sickle cell crisis. It was cold. The person didn't have adequate gloves on. They may have had low oxygen. They have sickle cell disease as such, and that's where they potentially reduce the flow in that blood vessel. And so what I want you to be aware of in like 10 minutes here was to introduce you to a series of different quizzes where we've taken different conditions in the body and have shown illustrations that I'll go over, maybe a couple of them in our next call. But in the meantime, I encourage people to come in and look at how sickle cell affects the body inside of these courses inside of our academy. All right.
And Rob,
yes.
Let's pull that up just for one follow-up question.
Whoops,
how do I know?
Am I still sharing? I stopped sharing.
Oh, no, you stopped sharing.
Go ahead. I'll share again.
Okay.
What's your question?
How can I actually earn credit for visiting? It says a challenge. So am I trying to complete and earn something?
Well, if you're seeing my screen now, oh yeah. If I let's just go back to vasoconstriction. If I stay and watch this, there is a timer that exists. And when I've been watching things for a minute, it'll give me this button called Mark Complete. When I click Mark Complete, I've now gotten points for this. When I take the quiz, I've now gotten points for this as well. I'm also able to make comments here if I wish, that I can share about what I learned or what else I might want to teach someone. Let's say I'm a hematologist who's here. So for everything you do in the course, when you take a quiz, when you finish a course, when you upload a post in the community, you're earning points. And we can go over that more at another time.
So I don't know about you, Moses, but I always enjoy Dr. Rob's 360 Explorer explanations. I call him the Mr. Rogers of like family general health for us moms. I really do. The way that you explain things, Rob, and then with the backdrop of the interactive 360 anatomy, to me is always fascinating. So thank you so much for that.
Questions from anyone who has the app. Just put in the feed, Dr. Rob, explain this for me, would you? And I'll either do it in a video right to you in the app, or maybe we'll use it on this show. So feel free to ask your questions. What don't you understand on any of the things? And if I don't know, I'm expert at saying it. And we'll find an expert, hematologist or whoever else we need to figure that out.
And before we transition to what's on the horizon, because that's exciting, it's starting to get hot out here in Arizona. And since this is really a, first of all, early on, a Sickle Cell Foundation of Arizona effort to reach out to, what needs to be known about hydration and temperature, hot temperature and hydration?
Oh my gosh, you have a real problem with hydration. If you get dehydrated, your blood vessels dilate near the skin because they're like a radiator. The body wants to get rid of extra heat. But as the blood vessels dilate, the pressure in those blood vessels drops. Okay? It's like if you had a garden hose with the same amount of water going through, but now it's going through a fire engine hose, it would barely come out the end. So with lower blood pressure, that blood is flowing slower, and it's much less efficient in getting oxygenated in your lungs when you are in a dehydrated state. If your oxygen is lower, your hemoglobin is more likely to change from this shape to this shape, and then line up with one after the other, after the other, after the other, to make a long chain that just pushes that cell into that sickle shape. So dehydration makes you at risk for sickle outbreaks or crisis.
And heat then would that then just be the relevant associated to hydration?
Yes.
When it gets cold, it constricts. I get that, but I was wondering if anything happened in extreme heat, other than you just have to hydrate.
You have to hydrate, but the heat in impaired state of lower blood pressure affects your body's ability to get oxygen out of the lungs and get it to the tissue. And low oxygen causes your cells to sickle, and the sickle cells get in a big traffic jam, like on the interstate to Phoenix. And it doesn't take much of a few jackknife trucks or what a sickle cell does to the traffic. And all those normal cars can't get through.
Awesome. And Moses, great advice, right? Anything else?
Wonderful, wonderful advice, because you hear these things. I think in one of the presentations, it's sickle cell disease manifestations. So when you hear about the blood getting stick together and all of that, when the oxygen doesn't flow, what happens to the body? So organs begin to die slowly. So many things happen to your body. What happened if that happened in your brain?
Well,
in your
we'll
organs.
Go over that on our next call. We'll go over that in detail.
Okay, so that's the reason it is imperative for us as a community to know more.
Yes, sir.
Exactly. And it's just fascinating because the more we know, even I'm not living with sickle cell, but now I feel empowered to at least, have an intelligent conversation if I do meet somebody that does. That's all what it's about. This last segment, we called this segment "On Your Marks, Get Ready for Summer," right? We literally just went live with a soft launch on this app last month. Last April was our very first monthly insights, but we are leaning in towards June because there are many things that are happening towards June. So let's just do a quick recap on what we've got coming up on here. June 5th, we will be out at We, meaning the Force for Health, and all of these initiatives with African American health is really going to be expanded throughout the whole month of June here. I don't know how you're doing in Pennsylvania, Rob, or I don't know how our partner is doing in Florida, but the directors and the team leaders of the Tucson Juneteenth Festival, kind of like a bowl game, you have all these associated little events so that you can expand the impact of what they're trying to do. So they'll be hosting a health and wealth event at Dunbar. June 14th is very exciting. We all work very, very closely. American Red Cross will be co-hosting their annual community roundtable called Sickle Cell Advancing Together. Literally confirming within the last 24 hours, it will be from 2 o'clock to 4 o'clock. We will circulate flyers and get it up on our calendars, probably by end of day, if not by tomorrow. But that's for anybody to come in and learn about sickle cell, and that is here in Tucson, Arizona at the Dunbar. So just be ready for that. The theme of this year is really addressing stigma and celebrating our new resource, the 360 SCD Hub. So very excited about that. June 15th, the following day, we'll be out at Keno Sports Park doing some fun move your blood, move your body type of challenges with some partners. June 21st, we've got a partner that will be doing a blood drive out at the Marana Chamber of Commerce. I love bringing the private sector into just looking at blood and all conditions of blood. And then Moses, this June 29th to June 30th, your family education conference is just going to be, the cherry on top of the cake or sundae for June. Do you want to speak to this?
Yes, indeed. Thank you, Lucy. In 2019, we had the first ever family conference in Arizona. And we had close to 200 people in attendance. That was something. That was incredible. And then the pandemic came with all the ramifications, and we are unable to continue. Then in 2021, we started again. And now we partner with Arizona Blood Alliance, with the Red Cross, with Arizona Department of Health Service, with other entities. But primarily, it's the Sickle Cell Foundation of Arizona going with Arizona Blood Alliance and all our supporting partners to host this event. We had it last year and we had it a year before. And those who are from long distance like Tucson, will give them a $50 gift card. So then when they arrive Phoenix, they would get a $50 gift card. The room is first come, first serve. So if you RSVP on time, you'll have a free room Friday night, because we know that driving out of Tucson to arrive there at 8 o'clock in the morning takes some time. You may need to get up at 5 o'clock. So we do provide a room at the facility so that you may stay throughout the conference. And it lasts from Saturday through Sunday. And we have great tracks, sickle cell track. We have keynote speakers. One of the major things we're going to talk about is the pain management. We want to take the stigma out of pain management. There's something called loss to follow. There are people who are lost out there, and part of our effort is to reach out to you. So please share this information. There'll be the tracks for kids. We've sent out the program, the promotion, the track for different age groups and different speakers. It's always an exciting time. And we are very fortunate that we are able to do this.
The most exciting thing I heard you say, so did I hear it right? That you guys will actually be paying for a number of first attending registrants?
Yes.
How many rooms are you accommodating? Did I miss that?
I'm not sure yet. I'm still getting the stats because it's based on registration, because you don't want to get a room that people going to stay. We learned that in the past, and then people don't show up. Then
I see.
Hotel cannot lose their money. So it's really, that's the reason we're encouraging everyone. If you know that you're coming from a farther distance, please register.
Is that hotel room gift sponsored by the Sickle Cell Foundation of Arizona, or do you have a sponsor that is helping you with that? I think that's a great, after 25 years of conferencing, let me just say, if you're throwing in a free hotel room, That is a beautiful little carrot that I've never come across before, right, Rob?
Correct.
Yeah, exactly. So let's play with that a little bit. So
Who's paying
everybody
for it?
register, and then
Yes, we have a number of sponsors who have been sponsoring us over the years, like Pfizer, like Vertex, like Banner Health.
Awesome.
My goodness, a number of Arizona Department of Health Services. So we have a number of entities who
Excellent.
work with
Yeah,
us and
that's
make
great.
donations towards,
Good for them.
yeah, to so that we are able to carry on this event year after year.
Well, I think that that's wonderful. So, wrapping up our monthly insights, right? Together we can make a difference. And this platform right here, this broadcast that will then be recorded so that you can watch it at your leisure from your couch, from the YouTube channel, if so be it. Right now, we are hosting this show at the Force for Health Network's YouTube channel until the Sickle Cell Foundation of Arizona gets their own. I'm just trying to find easy ways to watch this from the couch, right? And so we will, if you search the Force for Health Network, there is an actual playlist and where all of these are house or host. If you have Facebook, of course, you can watch it again on Facebook or over at LinkedIn. But it is meant to reach out, continue to communicate and celebrate the ecosystem, connecting platform that we built together with you called 360 SCD Hub. Again, our monthly training for community health workers and coaches for the app. This isn't specific community health worker training. This is really app and platform training, how to use it for myself and how to learn how to use it with those that you work with. So that is the third Tuesday this month coming up. And I just want to bring special attention again to the partners that are surrounding us at the table. Moses, it's been beautiful to work alongside you because I'll tell you what, you really have great respect and connections into all the hospitals and all of the kind of healthcare leaders in your proactive stance here to make sure that, hey, if somebody is tagged or, screened as sickle cell, send them our way so that we can pull them into our hub of resources on that. I'm going to take that away. Final thoughts I'm excited because June, there's a lot of exciting things to get ready for. I'm excited to launch some challenges with you.
Mm-hmm.
Olympics is coming up in the end of July, so I challenge us all to find our inner athlete. We're excited to kind of gamify some things together, and let's challenge people to be bold, right? And to it's all about connection. And the easiest way to connect and put the whole network, peer, and resources to download the app. You can use the app without a login. You won't have access to certain groups and you won't be able to post, but it is free to download and the easiest way to start connecting the resources, period. 360scdhub.org or any of the QR codes that you saw during this deal. So I want to thank my guest, Dr. Robert Gillio out of Pennsylvania, Moses Akpan, our fearless leader, Executive Director and President of the Sickle Cell Foundation of Arizona. I love that you're based here in Tucson with me, although out there on the east side. Final words of wisdom for our audience and your supporters, Moses.
A quick announcement. For those who are coming, and we do encourage you to come, June 14th, we'll be giving $10 gift card away, plus other freebies.
Oh, June 14th. Okay, that is for the Red Cross.
Yeah, for the we work. Yes, we actually. Yeah, we partner with the Red Cross to host the launching of the app and celebration of the World Sickle Cell Day. So please come. This is a great platform, a great opportunity. Never thought that wildest dream that this would actually come to pass. I want to thank HRSA because we work very, very hard to get the the funding to be able to develop this app. It's I can't tell you how hard we work, and I'm so blessed, and we are also blessed with the working with Force for Health and all the team members who dedicated their time to make this dream come true.
It's only just beginning, though. My final words are: if you're out there at the app is a platform. It's built. It's like we've built a pickup truck. How are you going to use it? So if you're a patient or someone living with sickle cell, you have questions, or if you're a physician, share the questions. If you're an expert or have an insight, share that as well. We have the ability for you to publish as well as ask and learn. So reach out. We're creating a community of support to reduce stigma, to manage the pain, and to really empower the sickle cell patient to be a good part of the community.
Wonderful.
And we want to overcome the social determinants of health.
Okay.
When I was talking to Courtney earlier with the Red Cross, she wanted me to remind everybody, summer typically, especially here in Arizona, blood donation is low. So one of the blood drives on there, June 21st, is a great opportunity to lean in, contribute, and donate, because healthy blood all the way through is the gift of life, right? So just a reminder, hydrate and know your blood and move your blood and give your blood. Come join us out at Juneteenth or any one of the health fairs this month if you are here in Tucson and or Arizona for the Family Education Conference. We will see you next month, the first week of June. So thank you very much for joining, and take care, everybody.
I'll see you on the app as soon as you download it. Talk to me.
Perfect. Thanks, everybody.
Thank you.